dive into Alberta. Much has been made of the Alberta model oriented on recovery and treatment. However, recent data highlighted that overdose rates in Alberta are rising fast since it was put in place, much faster than in British Columbia. Maybe you can talk about why do you think that is? You got about 60 seconds to do that.
Sure. I think it's always a result of multiple factors when we're looking at trends in drug poisoning. Some things we're seeing in our province that are concerning. There's been a substantial reduction in the number of people using supervised consumption sites. It's about half of what it was before the pandemic, and I think it is because of the lack of incorporating inhalation, as well as a number of closures and relocations of the services that have disrupted connections to care for people who use drugs. We are also, like I mentioned, seeing a lot more deaths in public spaces. We need to be addressing homelessness and unstable housing. I think if people had safe places to live with proper services and wraparound care, they wouldn't be dying of drug overdose on our streets. Beyond that, we have relatively low rates of opioid agonist treatment coverage for a province of our size. Only about 14,000 Albertans in Q3 of 2023 were being dispensed opioid agonist medications. That just seems to be quite a low coverage rate. And so I think we need to also do more to expand access to opioid agonist treatments in our province. And of course, I don't know why Alberta hasn't moved to trial safer supply. It is potentially a very powerful tool, as Dr. Nozick spoke to reduce mortality amongst a subset of people who use substances. And we need to use every single tool we have to address this generational and staggering crisis.
Thank you very much, Mr. Johns, Dr.